Hi everyone, welcome to my YouTube channel. It's all about the respiratory therapy, and in today's lecture we're going to learn anatomy and physiology of respiratory system. Firstly, don't forget to subscribe my channel and hit the bell icon. You don't have to take screenshots of each slide, just go to my Instagram from the link in description below and DM me the title of topic you need slides of. The respiratory system plays a vital role in oxygenating the blood and removing carbon dioxide. Understanding its anatomy and physiology is essential for a respiratory therapist to assess and manage respiratory conditions effectively. Anatomy of the respiratory system. The respiratory system is divided into two main parts. Upper respiratory tract, nose and nasal cavity, warms, humidifies, and filters air. Pharynx, a passage for air and food. Larynx, voice box, contains the vocal cords and prevents food from entering the airway. Lower respiratory tract, trachea, a rigid tube that directs air to lungs. Bronchi and bronchioles branch into smaller airways, leading to the alveoli. Alveoli, tiny air sacs where gas exchange occurs. Lung mechanics and gas exchange. Lung volumes and capacities. Lung function is assessed using pulmonary function tests, PFTs, which measure tidal volume, TV, air moved in and out per breath, 500 ml. Inspiratory reserve volume, IRV. Extra air inhaled beyond normal breathing. Expiratory reserve volume, ERV. Extra air exhaled beyond normal breathing. Residual volume, RV. Air remaining in the lungs after full exhalation. Vital capacity, VC. Maximum air exhaled after deep inhalation. TV plus IRV plus ERV. Total lung capacity, TLC. Total lung volume, including residual volume. Mechanics of breathing. Breathing is driven by pressure differences between the lungs and atmosphere. Inhalation, inspiration. Diaphragm contracts and moves downward. Intercostal muscles expand the chest cavity. Air pressure inside the lungs decreases, drawing air in. Exhalation, expiration. Diaphragm relaxes and moves upward. Chest cavity decreases, increasing pressure. Air is pushed out of the lungs. Gas exchange, the alveoli. Oxygen, O2, moves from the alveoli to the blood. Carbon dioxide, CO2, moves from the blood to the alveoli for exhalation. This occurs via diffusion, driven by concentration gradients. Oxygen transport and ventilation-perfusion relationship. Oxygen transport in blood. Oxygen is carried in two ways. Bound to hemoglobin, HB. 98% of O2 is transported by red blood cells. Dissolved in plasma. 2% of O2 dissolves in blood plasma. Ventilation-perfusion, V/Q relationship. Ventilation, V, air reaching the alveoli. Perfusion, Q, blood flow reaching the alveoli. Normal V/Q ratio, 0.8 more perfusion than ventilation. V/Q mismatch can cause respiratory distress. High V/Q ventilation-perfusion occurs in pulmonary embolism, where a blood clot blocks perfusion. Solution, blood thinners to dissolve the clot. Low V/Q perfusion ventilation occurs in pneumonia or airway obstruction, where ventilation is reduced. Solution, oxygen therapy and bronchodilators. Understanding lung mechanics, gas exchange, and oxygen transport is crucial for diagnosing and treating respiratory conditions. V/Q mismatch is a key concept in managing patients with hypoxia. Thank you. See you in the next lecture of pulmonary function tests. These are the basic lectures of respiratory therapy. We will move towards in-depth of each topic in lectures ahead.